Prior to entering the patient's room, I'm going to check the physician order for a Foley catheter insertion. I'm going to wash my hands. Knock, knock, knock. Hi, Ms. Smith. I'm Kirsten. I'm going to be your nurse today. We're just going to be doing a Foley catheter insertion to help you get more comfortable and empty your bladder. But before we begin, I just have a few questions for you. Can you give me your full name and date of birth? Okay. I'm just going to check your wristband. So both identifiers do match up. And then do you have any allergies that we should know about? No? Okay. And then when's the last time you emptied your bladder and how much? Perfect. Okay. All right. So when I leave the room, I'm going to go gather my supplies. And when I come back, I'm going to pull the curtain, wash my hands. And on my way back, I'm going to check the package for an expiration date and making sure that there's no holes or anything going on with the package. All right. So right now, with my hands washed, I'm going to look to see if she needs to be cleaned up at all. So I'm going to raise the bed to a working height for me, making sure the side tables are also at a good height. So if she needed to be cleaned, I would put on gloves, wash my hands. We put a blue pad under her and just making sure there's no urine or stool, anything that could contaminate our sterile field. So right now we would also put position their legs into the appropriate position. So for males, they're going to be in a supine position with their legs straight and slightly apart. And for females, they're going to also be supine with their knees facing the ceiling, so it's going to be a triangle. So I cleaned her up, so I'm going to discard my gloves and I'm going to wash my hands. All right, and then next we're going to start our sterile field. So with my hands washed and everything at a good height for me, I'm going to begin. So the packaging is going to be our trash. So we're going to fold that over, placing that over our patient. So we're going to open our package away from us and then only touching the edges. Okay. All right, so next, so our patient is a female patient, so her legs are going to be facing towards the ceiling. So with our blue pad, we're going to take it away from us. We're going to make sure that the shiny side is facing us. So we're going to come around her knees and we're going to fan towards her feet. And we're going to drop it, making sure that our gloves don't touch her thighs, and we're going to make sure that there is no space between the mattress and her bottom. All right, and then this is an extra drape that we use for male patients, but we don't need this in this procedure. All right, so I'm going to take my alcohol swabs out. Next, I'm going to do the lubricant and place that into our lid. Next, I'm going to take the cap off our syringe and we're going to place the syringe onto our green port of our catheter. We're going to place that in the tray, making sure it's tucked in. And then with my other hands, I'm going to take the catheter tray or catheter wrapper off, controlling the catheter as I take that off so it doesn't flop around. We're just going to place that into the box. Next, I'm going to place the tray back on. And then we're going to come around our female's knees and we're going to place the tray, keeping that 1-inch border. All right, and then for our female patients, we're going to spread the labia. We're going to begin cleaning with our alcohol swabs. So you're just going to feel a little pressure down here. We're just going to get you cleaned up, okay? So we're going to take one swab each to one side, and we're going to come around her knees. And then our last one, we're just going to go one swipe down the middle. Alright, and then next I'm going to take the catheter and we're going to put 1 to 2 inches of lubricant onto it. And then for males, we're going to do about 5 to 7 inches of lubricant. Alright, and then I'm going to cue the patient to make sure that she knows to breathe while we're inserting it. And for females, we're going to go about 2 to 3 inches into the meatus. And then once we see the flash of urine for females, we're going to go 1 to 2 inches further. And for males, it's going to be about 7 to 10 inches into the meatus, and then once we see that flash of urine again, we're going to go again 1 to 2 inches. Alright, and then I'm going to, if there was any resistance going into the meatus, we would just go 1 inch further, and if that didn't work, we would just pull it out and we would start over. So right now, I'm going to inflate the balloon. Okay, and then right now with my other hand, I'm just going to give it a slight tug. Alright, so it feels good. I'm just going to hold this. We're going to take this out. We're going to place this back onto our field. And right now we would place the tubing onto the side of our patient's thigh, making sure that there is slack and making sure that there is no pulling that could happen. And then on our bed rail, we would place this and making sure that there are no loops. And if we needed a sterile sample, we would wash my hands and I would change my gloves. And right now we would take the cap off, placing that back into our box. And we would get a sterile sample from this, making sure that we don't touch the container. We would open this, get a tube sample, place that. We would take an alcohol swab and clean that, place that back onto the bed rail, take our sample, and we would send this off to the lab. So with this, with no kinks or no loops, that's to the bed rail. And we would get rid of this sheet. And we would discard our gloves. We would wash our hands, making sure that Ms. Smith is comfortable. We're going to cover her back up. We're going to put the bed in low position and discard our trash. Making sure she has her call light. And when it's time to discontinue the catheter, before we would do that, we would check the physician's order, making sure that we're doing everything correctly, and identify our patient again. We would wash our hands, and for supplies, we're going to need our pad, we're going to need our syringe, and our gloves. So we're just going to discontinue your catheter. So we're going to open her gown. We're going to place this below her. And then we're going to connect the syringe again so that we can deflate the balloon. Okay, so I deflated the balloon, so we're just going to have you breathe out. So I'm going to pull that out, and you can kink this so that no urine gets onto the bed. And then if there was any existing urine in the bag, we would take that to the restroom. We would empty that into the toilet. And then once we're done emptying that into the toilet, we would just throw this away into the regular trash bin. And then we would come back, we would wash our hands, take our gloves off. We would get Miss Smith comfortable, we would lower the bed, document it, and we would ask her to let us know the next time she urinated. We would look for the characteristics, so we would look at amount, color, smell, and see if there was any abnormalities, look for blood in the urine, or we would tell her that if she wiped and saw blood to let us know. And then we would document our findings, and we would pull the curtain back and we would go wash our hands.